Right. So if you have read and understood, considering its surgical pathology station, can you please define the term sickle cell disease?
Sickle cell disease, it's a deformity in RBC's morphology because of alternative of glutamate in HB in hemoglobin to valine acid, which make a new hemoglobin, which is HBS.
Okay. Can you tell me, right, can you tell me according to, yes, according to this definition, what is missing in the hemoglobin? If you can tell me, what is substituted by what when the hemoglobin is
The,
formed? Yes,
the glutamate acid
yes.
will be this is normal, and valine will be make the new hemoglobin, which HBS.
So it has,
This is a new.
in a normal human, there are 2 alpha and 2 beta chains for a hemoglobin. So what's happening here?
Yes.
Instead of
Uh,
formic acid at position 6, you are having
instead,
hemoglobin S. Yes. So how hemoglobin
yes.
S is at more disadvantage than hemoglobin A? Can you define, or can you give me a few examples?
Uh, Again, the question, sorry.
Normal hemoglobin, it's hemoglobin A. So in this one, sickle cell disease, hemoglobin S, why is it less better or more disadvantage than the normal one?
Yes, because it has it can't move the oxygen, or it can't transfer the oxygen, not for particles. It will be two particles, so it
So,
will be less efficient, and it has
so yes, oxygen carrying capacity is less. What else does it do? Why the
uh,
patients with sickle cell disease suffer with body cramps?
yes, because it has not by concave shape. It can be moved
Yes,
easily and smoothly in the blood. It has make vaso-occlusive
very
crisis.
good. Yes, yes,
Sometimes it make sequestration complication.
yes,
It make blood ischemia in many organ because it's make obstruction in many blood vessels, which decrease the blood
very good.
perfusion.
Very good. Yes.
Uh, yes, it makes
Can you,
sometimes
yes,
hemolysis in the spleen and
yes.
autoimmune.
Which virus is known for it causing aplastic crisis in patients with sickle cell disease?
Epstein Barr virus.
Yes, parvovirus, P19. Okay, can you tell me, right, can you tell me what are the most painful crises that can occur in a patient with sickle cell disease?
Vaso-occlusive crisis.
Yeah, but that can lead to
It can be lead
worsening
to.
of anemia because these patients presents with very low
Yes.
values of blood, yes, hemoglobin values, and that is normal for them to live. So this patient has come in A&E and is unconscious. What would you do? And all of a sudden you have come across that patient has a mass. Would you go and treat or manage the mass, which was accidental discovery, or how would you manage this patient now?
At first, I will resuscitate the patient, and I will manage according to Atlas protocol.
ATLS
It will
protocol, yes,
be
yes.
it will be assessing the airway, the breathing, and follow, I will make two wide bore cannula to make two transfusion of crystalloid and the blood
Blood,
transfusion
yes.
need.
Good.
Before this, we make a cross and the saving group, and I will involve multidisciplinary team to help me manage this patient. After the patient, while it's stable, we can manage the temporal regions.
Very good. But at the moment, you don't need to. Can you please tell me why these patients become all of a sudden immunocompromised?
Because it has the sickle cell anemia complication, autosplenectomy, which make the patient immunocompromised against encapsulated organism.
Okay, good. Can you tell me, in this patient, what would be your ideal value of hemoglobin that you would want to acquire or keep your patient's hemoglobin at?
More than 9.
Yes, between 9 and 10. Very good. What advice would you give regarding tourniquets, use of tourniquets in patients with sickle cell disease?
Again, sorry.
What advice would you give to your nursing staff regarding the use of tourniquets?
I don't know.
You have to be careful with that, not to use it. Okay, considering that this patient who is already has sickle cell disease and is elderly, and now that you have discovered a new thing, a mass in the temporal region, so can you please tell me what are the most commonly occurring primary brain tumors in elderly patients?
Okay, medalloblastoma,
Yes,
glioma,
yes,
glio,
blood, yes,
glioblastoma and medalloblastoma multiforme.
yes.
And as meningioma, we have METs, secondary METs. We have two schwannoma, and we have
Okay.
squamous cell carcinoma.
What are the manifestations of brain tumor that you can expect?
Brain tumor, it's a space occupying lesion and the skull is closed space. It make increasing in intracranial pressure, which make a severe headache, especially in night and in morning. Sorry, it will make vomiting, and it depend after this on the site and the area of and the rate of growth of the tumor. If it for example, in the front, it will affect the personality change, and if it was in occiput, it will affect the visual field.
Very good.
Sometimes in pituitary make diplopia, and
Can you tell me what might happen if you decide to leave the tumor untreated?
it will be increasing in intracranial pressure, make herniation and conization of the brain, and after this, it will be this.
Okay. So just suppose you've taken a small piece of biopsy and you've find out that the tumor is squamous cell carcinoma. So what might be the possibility?
The possibility of squamous cell carcinoma.
Yes.
The possibility it will be a melanoma send emits to the brain.
So the primary origin is somewhere else.
Okay, it will be anything from perineum, genitalia, skin,
Yes. So the
any
primary, yes. So it's not the primary brain tumor of the brain. It's spread or secondary.
yes,
Primary
mets,
origin is
yes.
somewhere else. All right, very good. So, right. One last question. After biopsy, patient's wound is not healing and it has become infected. What is the most common organism to find?
Staph aureus.
Very good. Thank you.